Please enter your passcode followed by the pound or hash. Please hold while I confirm your passcode. Thank you. Your passcode is confirmed. When you hear the tone, you will be the... I was the publisher of Working Mother and Working Woman magazine. Prior to that, I owned my own custom publishing company. Prior to that, I was a top producer at Xerox Corporation, where I actually supported their customer relationship management tools and software development. Most recently, I'm the author of Winning the Toughest Customer, The Essential Guide to Selling and Building Loyalty Among Women. So I'm going to bring to you a quick synopsis because we only had a half an hour scheduled. I'm happy to spend a few more minutes on the program for you, but let's get started so this way we can move this forward. Okay, what we're going to do today. What we can do today is really just learn a little bit about the influence. I just want to go over a couple stats with you. These are great stats to take back to your team, to identify any current challenges that you may have or just share with them to build a business case. I want to share with you some key insights on how women make decisions, how to make that very first right impression with her, how to learn how to raise the standard of service, boost satisfaction and quality care. It sounds like a lot to cover in a half an hour, but again, I'm going to give you some very, very strategic points to take back and to put into action right away. And here's what we are going to do, because we looked at this and said, boy, oh boy, do we have so much to share in so little time. So we're already scheduling, and I'm going to go at the end of the webinar, I'll go over our next webinar in, I think we're going to do this in January, where we're going to go over really a system with, like 51 points on how to create the ultimate customer experience in your hospital, and that will cover more detail. But for now, let me get on with the information that you need. Okay, the need for healthy communications. You know as well as I do. I mean, with HCAHPS results demonstrating that on average, only 70% of your patients would consider recommending hospitals. This is a nationwide, total curve. We're showing that we have a long way to go to driving customer and patient satisfaction. The other thing, too, that we're finding, again, with this is that about 20% of patients did not feel that they had a good communication or that they experienced good communication with their doctors and nurses. That's a big chunk, all right? So that's 2 out of 10 of your patients walking out saying communication was really poor. So we have a big opportunity to increase that. And even if your patient satisfaction scores are above that, and as award-winning hospitals, yours typically are, at the 80 percentile or above, you still have a way to go because, the goal in any company is to go from good to great, and that's why we want to help push it to the next level for you. Patient satisfaction isn't a customer relationship. It's a health issue. And more importantly, everybody always says to me, I was just yesterday in D.C., speaking at a conference, it's how do we drive this? Well, it always comes down to a simple, fact, and that is that communication is the driver of satisfaction. The more we have information, the more tools we have, the more we have effective communication skills with our doctors, our nurses, our staff, our greeters, the people who, check us in, everything that has to do from the valet. I mean, you think about every touch point to the patient is a communication touch point. And how a person experiences their care is just by itself, again, it all comes down to good communications, and that means less errors are going to occur and, greater whatever processes and procedures. And please, if you recall, I'm keeping the line open because I wanted to make this interactive. So for those who are on the line, for those who are on the line, if there's if I hear too much noise, I'll have to shut down. I could take a second and shut it down, but I want to keep the lines open because I wanted to actually invite you to ask me questions throughout and toward the end. But if there's noise or if I hear talking, then I'll just have to shut that down. So please try not to be in a noisy environment or put us on hold so we hear music. Anyway, hospital challenges. Satisfaction is right up there. Patient satisfaction has plunged, actually. Even though we're seeing more of an effort, we're still seeing that the scores are not moving in the right direction. Satisfaction with outpatient services remain high, unchanged with a score of 80, but
inpatient satisfaction fell, and then talk time is short. This is always interesting to me because I studied gender communications, is that, patients have on average 23 seconds before their doctor interrupts them. But here's the key point, is that women speak, for every one word a man speaks, women will speak 3. Okay, so you know that by the time she's ready to really get to the heart and soul of what her matter or issue is, in 23 seconds she's barely gotten to the beginning of her of the core of what she wants to share. So most women are saying that they're feeling rushed and interrupted. Many term it as rude and condescending. It was a perfect example. My mother just yesterday called me that she went to see her doctor following surgery, and this is a hospital that is extremely well respected, and yet she said not only would she never go back to him, but that she found him rude, and because he didn't explain what was her concerns. He said, I did my job, you're well, you're good, but her concerns were not addressed, and he just brushed them off as if they're not important to her, and she left there. She said, I was absolutely frustrated by the fact that he didn't even take into consideration my concerns, cut me off, told me that I'm fine, don't let anything bother you, and yet they are my concerns. And remember that everybody's entitled to their concerns. Everybody's entitled to their feelings, and everyone is entitled to be heard. So we want to, correct that going forward, and this is what this webinar is intended to do. So hopefully, you have a lot of quality control people on the phone as well, but if you're taking notes or applying this to some of your best practices, let's seriously think about, what are the key takeaways you're going to take back to your team, and that is one of them. Now, poor communication also has a problem when it comes to healthcare, and that is adherence, that is compliance. And so, we're finding less and less people are complying with their medications because when we go out and we survey our customers and we survey patients, it always comes down to communications. It's one of those things where, the more empowered we are as customers, the more inclined we are to make smart choices. Not being compliant with your medication is not a smart choice. So I have to, we have to put the blame on the people who are, giving them the information, whether it's the nurse or the doctor, whoever it is that's talking to them about their medication, regimen and what's involved and what's important to them. It's not about handing them a slip and telling them to take this twice a day. It's about asking lots of questions, rephrasing what their concerns are, letting them understand what the medication will do for them, and then reiterating it back so that they understand that it's coherent, it's clear, and then they also understand the ramifications should they decide to stop the medication. Okay? So, and the perfect example, again, and I love to go back to real-life stories here, is that, somebody in my office has a child, and he was feeling better after a couple days of being on antibiotics, and she said, I think I'm going to stop him because I keep on reading about all the bad stuff with antibiotics. And I said, well, didn't the doctor explain to you what will happen if you shorten the the full dose of the antibiotics? And she said, no, he didn't. Those are the type of things that drive me insane as a communications specialist, because I understand the importance of how adherence will be a complete direct result of proper communication. Going to the female a little bit more and talking to you about really what impacts her preferences, whether it is to refer you, whether it is to provide you good scores. Understand that women are very different than men in that she has something called a radar that is far-reaching, meaning that everything that goes on around her it gets absorbed into an end result in how she perceives that experience. So, next webinar we're going to talk to you about all the things that your hospital has to do to create a women-friendly environment. But for now, keep in mind that when you're speaking to her, she's not just listening, giving you lots of eye contact and listening to you, but all your nonverbal communication is going to absolutely impact how she trusts that communication process, how she interprets what you're saying, whether or not she believes that you are, giving her the complete story. If she needs more information, everything will be taken from her nonverbal or his or her, whoever's communicating the nonverbal. And keep in mind that when you're talking to your doctors and your nurses and your staff, it's not just about their nonverbal communication. It's also about the patient's nonverbal communication. They need to be not just focused on what they want her to hear, but what she needs to be reinforced, how she needs to be reinforced, and what her needs are based on her own nonverbal communication. When you watch two people interact, body language is amazing how much more it says about how a person is interpreting that communication than the actual words that come out of your mouth. And according to the research, 80% of messages we send and receive are done so without ever saying a word. And that's why, we talk about, creating the best patient experience when you want, that 5, 10, 15-foot rule. And by the way, we had that downloadable worksheet in your Healthy Communications newsletter. If you didn't receive it, that came out a couple months ago. Make sure that you get to Susan and ask her for that one, because, nonverbal communication happens from the second she drives into your parking lot, where you walk in and you start seeing friendly faces and you start seeing smiles. Remember that 5, 10, 15-foot rule that, as you're walking through the corridors, as you're being served as a patient or even a visitor in your facility, you want people to feel welcomed. That's just one part of nonverbal communication and patient satisfaction. But remember, when she's talking to the nurses and doctors and staff, that, giving her direct eye contact, giving her all the things that she needs to feel that she's being respected is important. Now, let's go beyond that a bit. Interestingly enough, when we talk to her about, what impresses her, what makes her feel good about working with that staff member, she says that it goes beyond, her nonverbal communication extends to something called shared values, okay? So, when she's dealing with a nurse or a doctor, she in her head, your patients already have a preconceived notion of what they want their doctors and nurses to look like, how they want them to behave. And so your hair, your attire, the jacket that has stains on it, all of those things those are critical communications to her. That's telling her you don't care, and that's telling her that you may not have the facility that's going to provide her the best healthcare solution. So believe it or not, when you survey women in the communication process, you are completely responsible for the physical nonverbal part of that. And so make sure that, you're very much taking that extra care in creating the right image. Now, when we say, are you present, okay, and, by the way, I'll go back to handshake. The handshake's important. When you shake a woman's hand, make sure you gave her a handshake that is respectful, not a bone crusher, and not a wimpy handshake, but one that is embracing her hand and demonstrating care, concern, and respect. The other is, are you present? Are you focused on her? Are you distracted by things around the room? Are you looking down at your chart when you're talking to her? Obviously, those are things that are concerning to her, because when she's talking to you, women need eye contact. Think about, I laugh, people laugh, but I always give the story, when I give my husband that list to go to the supermarket, if he's watching TV, I literally put it on pause on TiVo, and I look him in the eye, and I said, listen to me, I need you to make sure you get it right. And, and this happens all the time. I need the eye contact and assurances that they're listening to me. So when a doctor or nurse is listening, or the patient is talking, you actually don't look down. You actually don't, you could look down to take notes, but that's about it. And if you need to read something, you go, listen, I know what you're going to say is important, so give me a second to read your chart, and then I want to give you my utmost attention, okay? Eye contact. Women need more eye contact than men. Women need 60 to 70% more eye contact to feel that they were heard than a male does, okay? So knowing that stat, You want to make sure you empower your people to understand that when you're speaking to a female, the more eye contact, the better. And, of course, you understand the importance of smiling. Smiling is important to her. Do you use her name? Now, her name is important. When you walk into a room, when you're with the patient, it's best to use her name. Okay, Ms. Patsy, how are you feeling today? Or Delia, how are you feeling today? But the point is that you want to use her name. So the nurses and the doctors need to make sure that they address the patient always by their name. It's important to them. It's personal. It also reassures them that they're getting the right medication, the right services, because you're addressing them by the name of the person that's on that chart. Okay. All right. Now, adapting your code simply means, code switching is a term that we coined that simply means when you're dealing with a female or a couple, you need to be more aware of the differences in your approach to how they actually approach the decision-making process. And the decision-making process is very much about, are they going to choose your hospital? Are they going to choose that doctor? Are they going to recommend you? Are they going to feel good enough about you to score you well in those HCAHPS scores? Are they going to go out and share with their family and friends the experience that they had? So let me go through this pretty quickly. But just remember, men talk to achieve and compete. They talk to get to the end game, okay? It's all about the end result. When we surveyed, and many of you know about the Wharton School, the program that we did together, we conducted a joint survey on gender-based customer satisfaction. What we found is that, in essence, men were always eager to get to the end result. So, if he's sitting there with a doctor, the whole story and explanation will serve him well. But at the end of the day, his mind is focused on, well, what does this mean to me? How quickly will I be able to get, whatever I need to get to the end goal, which is to make me healthier or get me through this surgery or get me through this procedure. So his mind always focuses on that is what he's looking for. Whereas for the female, interestingly enough, she actually is more engaged with the body of the conversation. To her, it's all those what many healthcare people would think is peripheral. It's the stuff that reassures her, that builds her trust, that makes her empower her. Those are the things that are actually more important to her, because what will make her decide whether or not to choose you is if she feels that she can trust you and that she has a relationship with you. Okay? Once she feels that she's built the communication strategy, once she's built the relationship with you, and that happens through communication, then she's able to refer you, she's able to feel confident, she's able to make that decision to go forward. Okay. So next slide. Here's some basic things you can do. And most of you know this. Sitting down, I've been saying this for about, 15 years, and speaking to colleges and universities and medical students through the years, always as a keynote. I've always said that before they started to make it a mandatory or best practices, but it was very much common sense to me in studying gender communications, in that women need a lot of eye contact, men appreciate the eye contact, but women actually need it. So there's a difference between need and appreciation. And so, giving them as much eye contact, being able to be at their level, not condescending and looking down at them, and also being level, eye level to them is very important. There's also another thing that they don't realize about that. Women are less comfortable with males and even females, but mostly males, looking down at them. We do a lot in the mattress industry. Okay, you guys, your patients are laying down all day long. We do a lot in the mattress industry, and we tell them that the reason why women feel less comfortable than a man buying a mattress is because she has to actually lay down in front of you to test it out. So because we're in a hospital, makes it a little bit more easy for us to be in that situation, but it doesn't take away from the discomfort of being exposed in a laying position with a male or a female above us. So think about that. I talked to you about eye contact. Remember the 60-40 rule. That's a best practice. Paraphrasing back to her is very important. You know what? if she should say to you, well, you know what, I keep on experiencing these certain things. You know, your job as a healthcare provider is to just not take notes, but actually paraphrase back to her and say, okay, Delia, let me make sure I understand. Here are the things that I took note of, okay, or here are the things I'm going to share with the doctor. So paraphrasing back needs to be an active listening tool, and within the last couple months, again, we had a downloadable active listening tool. It's an interactive training tool. If you have not received it, ask Susan for it. She'll send you the newsletter that had it again. But all of these tools every month are delivered in your Healthy Communications newsletter. And then don't assume, you know, that your gut instincts are right. You need to know for sure. You need to listen to her, and then you have to paraphrase back. Many times when women tell you stories, they're telling you stories for a reason, not to waste your time. And your job as a good healthcare provider is to uncover what the underlying issues are and then paraphrase it back in a very distinct, direct way so that everyone is clear as to next steps. Gaining her trust and loyalty means that you're going to respect her as a decision maker. Always empower women. The more you empower women, the more that, you know, she'll feel confident in knowing that, you know, that she's with the right team, the right healthcare team, all right? Repeating and supporting her emotions. I understand. What that's basically saying is that with women, we really appreciate when people understand our concerns and our pain points. I could tell you a really fun stories. We'll have to do this another time, where the reason why women stay upset and angry longer than a male is because our pain points were not addressed. And so when you see a woman and you start to understand her fears, her concerns, you're reading it in her face. It's not like the story I told you about my mom yesterday. It's not about brushing it aside. It's about saying, I understand, you know, you're concerned here. I understand that you seem, you know, frustrated. I understand your impatience with this process. It's identifying what her concern and pain point is and then actually verbalizing it. When you do, something magical happens with women. They feel connected with you because they feel like they're being understood. And when we talked before about making it personal, her health care is a personal matter, okay? It should be to you too. Use your name. Use these emotion words. You know, we are committed. We are absolutely devoted here at you know, this hospital to do. You've got to make her feel like you are personally engaged and vested in her health. That's very important. And then the other thing we talk about that women really appreciate is knowing she's not alone. Okay? Oh, when we hear things like, oh, this is not to be worried, don't be too concerned because this is fairly common. Those are the words everybody wishes for, right? You know, don't be too concerned. This is fairly common. She wants to know she's not alone. And she also appreciates knowing the success stories of patients or females who have had these situations, and so that she could do, you know, she feels more engaged. Rethinking your strategy means that you're not about satisfying this customer. You're thinking about building a relationship for life. And building customers for life is the goal of every organization, every business in this country. And hospitals are no different. So we need to think about how we build this referral machine. And the one way to do it is to think about how you're communicating that request to her. Gender communication is very important. With women are far more likely to talk about you in a positive way, okay, and refer you, but you need to engage them. So I always ask at the end of, and I'd love to toss the question out, and we have literally, I have 1 minute to wrap up, so maybe we could stay and do some Q&A and talk about it. But think about, you know, how do you communicate what you stand for? Your vision, your mission, how do you communicate all of those important things to her so that when she leaves your hospital, that she has this in front of her? It makes it easier for her to think of, here are the 3 things this hospital stands for. So when I'm talking to my family and friends, I could share some of the values that not only I know that they stand for, but that I've experienced. And we'll talk, if you want to stay a little later, some marketing tools on that. But most importantly is always ask this very simple question. Ms. Tassi, how was your stay here at the hospital? Oh, I was treated very well. By the way, the food was delicious, and the nursing staff was great. Wonderful. Ms. Tassi, who do you know in your community would benefit from the type of experience you had here today or you had with us during your stay? Think of us. please think of those who would benefit from the type of experience you had with us. That is the key to driving a referral, because when you ask women to tell their family and friends, they're more inclined to not. But when you position it as who in your circle, in your community, would benefit from knowing about the services we provide here, now you've now placed it on her to share with her family and friends that she cares about, because when she cares about giving them a benefit, it now becomes more of an opportunity for her to take care of her network. And so that is actually a much greater successful way to build a referral. And so this is our last slide. But before I do that, let me give you some tidbits. And if you have a pad and pen, I will give you these, last minute thoughts that I jotted down so that you could take these kind of golden nuggets back to your team. Okay, the one thing I noticed in my observations with patients is tell the patient how you'll structure the explanation. So, for example, Delia, thank you for coming here, and here's what we're going to do. Okay, first we're going to cover your symptoms, and then we'll discuss your treatment plan, and then we're going to discuss your follow-up. Does that sound good? Okay. I've always found that patients love when you structure the explanation. You also want to be patient. Don't rush. Allow enough time, okay? Allow for questions and answers. Allow her to talk to you. She will absolutely reward you, okay, with her loyalty, with her dollars. And then the other thing, too, is sometimes we get overwhelmed as patients. And so you want to keep the information broken down into manageable chunks so that we could digest it, and we could and always leave with 2 or 3 key points, which I'm trying to give you some kind of key points right now. The other thing is account for stress, right? People are stressful in a healthcare situation, so repeat and rephrase. Remember I talked to you about the importance of that. And then use multiple forms of communication, okay? Ask for patients to take notes. You could use props, when you have the body parts that come apart, and then you could use techniques and tools. All right, so try to use multiple forms of communication, because there's a good percentage of Americans in the United States that do not absorb their information as well as you would think verbally. They do it more with visual skills. So remember that you're dealing with a wide sample of people, and you have to communicate to them on a level that will assure that they understood. That obviously means also looking at their literacy level, okay? Keep the conversation on track. If they ask questions or get sidetracked, redirect the questions back to the topic under discussion. So you want to keep it always focused on giving them what they need. And then I always say, it always helps you to give them tools to take home, when they're leaving the hospital. You know how you get the package, right, when you leave the hospital? But what about if you added some other stuff to it, okay? Some things about your hospital that they need to know. Some great tools, maybe an invitation to an event happening on breast cancer awareness or heart health awareness. I mean, think about things you can do to further that communication. And remember that, it's important that you always ask questions. You can never ask enough questions. Always discuss their lifestyle, medications, the pros and cons. Be as clear as you can with her when it comes to her communications. All right. So I'm going to, I want to congratulate everyone on this call today, obviously, for being a hospital of choice among women. There is no stronger honor, nothing that is stronger than being recognized by the person who's responsible for 90% of healthcare decisions and who is the toughest customer, hence my book, Winning the Toughest Customer. We want to help you. We are truly, I will tell you as a founder of this company, when I tell you that we are 100% committed to your success, but that means we need your help. We are going to continue to give you tools every month, but I need your feedback. We're going to continue to reach out to you, but we need you to use us, okay? I have my team hears it all the time. No is not in our vocabulary. It's let me see what I can do. Let's see how we're going to make it work. So whether it's creative support, whether it's strategy, I'm getting a lot of calls from hospitals now asking for more of a complete, consultations on their women's strategy. please tap into us. Okay, and with that, I will open up if anyone has any questions.
Ilya?
Yes.
Oh, good. I wasn't sure if I was on mute or not. This is Sally Sedgwick. I had a question on one of your very first slides where you said that satisfaction in hospitals has dropped 5%. Can you tell me the time frame? Is it in the last year, last 10 years?
Well, actually, we just this morning checked those stats, and those were 2011, 2012 stats. So what I'd like to do, though, Sally, is if you're interested, what I can do, because I'm seeing that that one is not sourced, I can get that to you.
Great, thank you
so much. To you. But it is, it's definitely. Sally, give me your last name again.
Sedgwick.
Sedgwick.
Big Fork Valley.
Okay, and the hospital again?
Big Fork Valley.
Oh, right. Okay, got it. Okay, let me get that sourced. Does anyone else on the call would like that sourced?
Yes, I would like that. This is Karen Navis in Kearney, Nebraska, Good Samaritan.
Okay. Okay, Karen, I'll get that to you as well. Okay, so actually Susan's here. I'm going to put on speaker so any other questions you'll take notes on that. Can everyone hear me?
Yes.
Okay. So Sally Sedgwick and Karen Navis, we need to source that first stat. Okay.
Is this webinar available for us to access again? Is it recorded?
Yes. Actually, it is recorded, and you'll be able to send it out, the link to, and thank you. That is an excellent question. It is, it's not only recorded, but you're going to be able to get a link where you can send it out throughout the hospital.
Awesome.
To all of your healthcare providers. And, for 30 minutes to hear some just important, even if they take away 2 or 3 golden nuggets, it can make a difference today.
You bet. Thank you.
You're welcome. That was a great question. Anything else? And there's always great questions. So anything else I can do for anyone out there or answer any questions you have? Okay, one thing I will say. Remember I was talking about the idea of, and we'll stop the recording earlier on, but remember I talked to you about the idea of when they leave the hospital, how you can get them to feel good about you. One of the things I always recommend is a letter or a note inside their package when they leave, as well as maybe sending them another letter. Again, sharing the vision of your healthcare excellence, reminding them, of why you're a hospital of choice among women and families in your community. It's because not only do we strive for this, but it is everyone within our hospital is committed to driving the patient's satisfaction as a critical part of their health care. And so letting them know that these are commitments you make is important for her feeling good about recommending you. It's kind of like when you go, I go into Whole Foods a lot. It's right up the street from my house. I almost wish it wasn't so close. They're so darn expensive. But I'm in there all the time. And, they have their vision statement right as you walk in. And so that constantly reminds me of their commitment to providing me, good products, organic products, healthy products, and how their commitment to the community is so strong. Think about what you're doing, in communicating those very important, visions or missions or whatever your advocacy is. Remember, that's important for her to know. We can't typically tell what they are when we walk through a hospital. So the more opportunities you have to touch her after is great. And so any other ideas? Anything else I could answer? Any other ideas I could do? Oh, the next webinar. The next webinar is Wednesday, January 30th. So pencil it in, please. Wednesday, January 30th. We're going to address a step-by-step snapshot on how to create a female-friendly environment to drive a positive patient experience. This will give you kind of scratching the surface of what we do. Many hospitals have started to ask us to actually do a site visit and assess their hospital. We do a 51-point assessment. It's a full-day program that we do. But I'm going to give you, in 30 minutes, I'm going to give you a big snapshot of the type of things you can look for in your hospital to make sure that, that you're addressing those women-friendly criteria. Well, I hope you've all enjoyed it. I've appreciated your time today. Thank you for being part of this webinar, and I'll look forward to speaking to you very soon.
Thank you very much.
Have a good day, everyone.
Thank you. Bye-bye.
Bye-bye. Bye, everyone.